Welcome back, this is Dr. Jenny Yoon. Today we're going to start a three-part series talking about the role of lymph nodes in breast cancer. You might ask, what are the lymph nodes and why are they important? Lymph nodes, act as filters for germs and a bunch of other waste products. And when we get infection or have cancer, then these lymph nodes start swelling because they're affected and they're trying to filter all these things before they spread to other parts of the body. Lymph nodes are important because they're our first line of defense against infection as well as cancer cells. These lymph nodes are scattered throughout the body, and they're connected by these vessels that are called lymphatic vessels. And what these lymphatic vessels do is they pick up extra fluid from different parts of the body, and they move them towards the heart, and in the process they have to go through different chains of lymph nodes. And once the fluid gets to these lymph nodes, they're broken down. Any germs or cancer cells and waste products are removed at the level of the lymph nodes, and the fluid that's clean will get transferred back to the heart so it can get pumped back into the circulation. So the lymph nodes that are affected by breast cancer are, as you know, located mostly under the underarm area we call axilla. There are also some of the lymph nodes that are located along the sternum or the breastbone, and they're called intramammary lymph nodes. As you know, in terms of breast cancer staging, number of these nodes that are affected by breast cancer is an extremely important prognostic factor. In the past, what we used to do when we did surgeries on these patients is that we took out a bunch of lymph nodes, whether they were normal or abnormal, because we couldn't figure out which ones were involved and which ones were not. Now we can actually map out these lymph nodes to see which ones are affected, and the goal being take out the lymph nodes that are abnormal and spare the normal lymph nodes, because lymph nodes are important and they're there for a reason. So if we start taking these normal nodes out along with the bad ones, then we start getting complications. And the way that we map out these abnormal lymph nodes in breast cancer is called sentinel lymph node dissection. The word sentinel means protector or watchdog. So when it's used in terms of lymph node terminology, the sentinel node means it's the first lymph node that is affected by the breast cancer, and it is our first line of defense against spread of breast cancer. The idea behind the sentinel lymph node dissection is that instead of removing a bunch of lymph nodes and trying to see which ones are affected, we want to remove only the ones that are most likely to be affected. And in this sentinel node, once we identify which ones are affected, and we take out the ones that are likely to be affected, and if they are normal, then we don't have to take any more of these lymph nodes out, which means we get to keep all of the normal ones that we need. And the sentinel lymph node dissection, the way it's done is that we inject a little bit of radio tracer that is radioactive around the breast cancer on the day of your surgery. This tracer is then picked up by the lymph vessels and is carried to the lymph nodes in the underarm area and along the sternum. And it's kind of like tagging, like if you're playing like paintball game, you tag your opponent. Just like that, what we do with the sentinel node dissection is we use a radioactive tracer to tag these lymph nodes that are abnormal, and we can leave as many healthy nodes as possible in order to preserve normal lymphatic drainage of the breast tissue, as well as lymph nodes that function in other parts of the body. The nodes under the arm, they're important not only because they drain stuff from the breast area, but it also drains the fluid from your arm. So if we take out a bunch of these lymph nodes, that affects the fluid drainage from your fingers and your forearm, back to the circulation, and that results in swelling of the affected arm, and we call that lymphedema. This is that's all for today. This is Dr. Jenny Yoon. See you next time when we talk about lymphedema, what it is, and how we treat it.